Question 1. Enzyme deficiency and biochemical pathway. A 16-year-old boy presents with dark-colored urine that turns black on standing and bluish pigmentation of his ear cartilage and sclera. Which enzyme is most likely deficient in this patient? A. Tyrosine hydroxylase. B. Phenylalanine hydroxylase. C. Homogentisate oxidase. D. Dihydropteridine reductase. E. Dopamine beta hydroxylase. Correct answer C. Homogenisate oxidase. Explanation. Alkaptonuria is caused by a deficiency in homogentisate oxidase, part of the tyrosine degradation pathway to fumarate. This leads to the accumulation of homogentisic acid, which deposits in connective tissue, ochronosis, and causes urine to darken on standing. A is involved in catecholamine synthesis, B equals deficient in classic PKU, D equals involved in tetrahydrobiopterin recycling, E equals converts dopamine to norepinephrine. Question 2. Clinical features and long-term complications. Which of the following findings is most characteristic of alkaptonuria? A. Hepatosplenomegaly and hyperbilirubinemia. B. Hypopigmented skin and hair with musty odor. C. Bluish-black discoloration of connective tissue and early-onset arthritis. D. Cherry red spot on the macula with hepatomegaly. E. Macrocytic anemia with elevated methylmalonic acid. Correct answer, C. Bluish-black discoloration of connective tissue and early-onset arthritis. Explanation. Homogentisic acid accumulates and binds to connective tissue, leads to ochronosis, causing bluish-black pigmentation of cartilage, ears, sclera. Over time, this acid is toxic to cartilage and joints, resulting in degenerative joint disease, arthralgias. Urine darkens on standing due to oxidation of homogentisic acid, a characteristic of liver or hemolytic disease. B equals typical of PKU, D equals Niemann-Pick or Tay-Sachs, EB12 deficiency. Question 3. Inheritance and diagnosis. A middle-aged man presents with chronic joint pain and says his urine sometimes turns dark if he leaves the sample out. He mentions his father had similar symptoms. Which of the following statements best describes the inheritance and diagnosis of this condition? A. Autosomal dominant disorder diagnosed by elevated methylmalonic acid. B. X-linked recessive disorder confirmed by skin biopsy. C. Autosomal recessive disorder with elevated homogentisic acid in urine. D. Mitochondrial disorder with lactic acidosis and hypoglycemia. E. Lysosomal storage disorder confirmed by enzyme assay in leukocytes. Correct answer C. Autosomal recessive disorder with elevated homogentisic acid in urine. Explanation. Alkaptonuria is inherited in an autosomal recessive manner. Diagnosis is confirmed by detecting homogentisic acid in urine, which turns black upon standing. Clinical features include ochronosis, arthralgias, and dark urine. A equals refers to methylmalonic acidemia or B12 deficiency. B equals not X-linked. D refers to mitochondrial disorders like MELAS. E refers to diseases like Gaucher or Niemann-Pick.